Just to give you a few examples of exercises that we had as tier 2 exercises, we have the Bulgarian squat, which for those of you who are not familiar with this is you have a box in the back or a bench or anything that keeps your back leg elevated, and you perform a lunge. So you squat down, you perform a sort of a squat, but using a lunge squat, but using the back leg elevated. So this was the Bulgarian squat. We also saw that the sumo squat was in the tier 2. So that's the squat that you perform with your feet pointed outwards. So that was also tier 2. We found that double leg, before that, the single leg squat, just 60 degrees, was also in tier 2. Double leg squat, full range of motion, was also here. The lunge. And then we had some jumps. So jumping from a box, the drop jump, the drop vertical jump bilateral was also here. Running was on the second tier, but it was much higher. It was one of the highest ones in the tier 2. We had the counter movement jump here, so you jump as high as possible with both legs. We had the single leg drop jump, dropping from the box. We had the running and stop. So you come running and then you stop abruptly. This was also tier 2. And also the Spanish squat. So it's an exercise that has been done a lot to rehab patients with patellar tendinopathy, isometric exercise. So you have a inelastic belt around your tibia, your proximal tibia, and then you just squat down to 90 degrees of knee flexion with 90 degrees of hip flexion. Your trunk is very upright, and you keep that position for a period of time, doing a very high intensity isometric contraction for your quadriceps. So this was also tier 2. So we found a big variety of exercises, different squats, a few jumps. They were all in tier 2. And the highest exercise from tier 2 was running. So this is actually interesting for us because we know if the patient is tolerating running well, he's running without any kind of pain, this means that he's tolerating that amount of load. So this means I can work with all these exercises from tier 2, and I shouldn't be too concerned about these exercises being too aggressive for the patient in that specific moment.